the final point I'll make on that is kind of just briefly explaining what Medicine 3.0 is, which is, because at this point it's self-evident, it almost doesn't need to be explained. Medicine 3.0 really has two main hallmarks. The first is that it is aimed at preventing rather than treating chronic disease by acting early, acting aggressively, and tailoring the therapies to the individuals based on the best available evidence, which is not necessarily going to be derivable from randomized controlled trials. And the second pillar of Medicine 3.0 is that Healthspan is to be given at least as much effort and attention as Lifespan. This is, again, another enormous difference between Medicine 2.0 and Medicine 3.0. Medicine 2.0 does not place emphasis on Healthspan. Its emphasis on Healthspan is anywhere from 0 to very small, depending on the subspecialty. So there are certainly some physicians whose practices do take them a little bit into the arena of Healthspan. But outside of, for example, physicians or healthcare providers who work specifically in the arena of mental health, again, it's relatively low. Obviously, orthopedic surgery is a discipline of medicine that is more squarely featured in the Healthspan arena. But for the most part, most of the healthcare dollars are spent on addressing and trying to elongate lifespan. And I would argue that we need to be, putting just as much effort into Healthspan. So that's the fundamental difference between Medicine 3.0, 2.0, and 1.0.